stage a little bit. The simplest way, I think, to explain the ageing population is to say that in the first half of the 21st century, the percentage of 65-year-olds will double, expected to double, and the percentage of 85 years and over will quadruple, which is a fairly staggering statistic when you think about it. Of course, when Peter Costello had a look at this in the first intergenerational report, he freaked out completely and immediately started thinking about raising the retirement age and a whole lot of policy innovations. But basically that document predicted a huge blowout in the budget over a 40-year period. And a significant part of that was the increased costs of health and aged care. And of course, before that, there was already a policy in place to support ageing in place, mainly because of the cost of residential aged care, institutional kind of solutions. And we know that housing and neighbourhood design is a critical issue to how long people are able to stay in their own home. And parallel to that, there are a lot of questions about the efficient use of the housing stock, whether or not older people who have smaller households in bigger houses, whether that's a good thing or not, for them and for the general community and for anyone who's looking for a house in a scarce and expensive market. Of course, we also know, and again, this is where I have to say I'm not a health specialist, but I did have a look at some ABS statistics on chronic conditions, and we do know that chronic conditions increase with age, and you can see some of them here that increase significantly with age. We also know that ability levels decrease with age. This is a graph from Australian Institute of Health and Welfare showing how severe, moderate, mild core activity limitation increases with age. And you can see there that the percentages get pretty high in the 75 plus age groups. Related to that is the need for assistance. This comes from the 2006 census, self-reporting on people's need for assistance, people who require assistance. And you can see again, it dramatically increases in the older age groups, up to almost half the 85 plus population. Of course, one thing that's very interesting, if we're interested in housing, is to what extent is this delivered in the home or in institutional settings. And this graph shows you where pretty much non-private dwellings covers a few other things, but it covers predominantly institutional kind of accommodation. So we can see here that even in the 85 plus, there's slightly more in private dwellings, and certainly if you take 65 plus or 55 plus, the vast majority of assistance is delivered in the home. And of course it's government policy to increase home-based care. There's been a number of programs over the last couple of decades that have stepped up the level of care in the home to the point now where they have a program called EACH, Extended Aged Care at Home, and one beyond that now, which is EACH-D, which is Extended Aged Care at Home Dementia. So they're now actually providing dementia services in the home. I noted that in a recent speech by, I think it was the head of the Alzheimer's Australia, that they're expecting that by mid-century there'll be 1 million people with dementia. So a fundamental question then is, if this is being delivered in the home, is how well is it supported by the design of the housing and urban environments that we have? Of course, there is evidence that older populations are more at risk. You can see some quotations here from the Cornell Institute for Translation Research on Ageing. Older populations are amongst the most at risk due to decreased mobility, changes in physiology and more limited access to resources, all of which may limit adaptive capacity among older and more vulnerable people. And then another comment from the same organisation about climate change representing a major challenge. Also, older people are more vulnerable to the effects of temperature extremes and have a significantly higher mortality risk in extreme weather events, both of which are likely to be affected by climate change. And older people being a particularly vulnerable group that are financially and emotionally less resilient to to climate change. Also, there are issues with awareness. I note also from some things I've read recently that there's also more scepticism amongst the older population and about climate change. And I read also that baby boomers, of whom I'm in the first year, I sadly admit, that we are we have a much bigger ecological footprint than subsequent older generations and and younger people. So there's some significant issues around that converge around the whole issue of ageing, the built environment and climate change. And the Stockholm Institute suggests that it's essential that the homes of older people are climate change proofed as quickly as possible, and they refer both to existing and new build. Of course, that's quite a challenge, particularly with existing housing, let alone, I mean, it is a challenge also with new build because it requires perhaps a different regulatory regime. When we look at the ABS census on older people, this is a very quick rundown on the basics. About 2/3 couples and 1/3 living alone. Only 5% in retirement villages, which surprises most people when I put that up, because there's a stereotype that says that most older people are in retirement villages. Only 8% of 65 plus and 30% of 85 plus in non-private dwellings, in other words, in institutional care. And if you weed out of that the non-age specific institutional care, it's only 3% and 26%. So it's still it should be 85 plus there, not 88 plus, by the way, in line 2 of that point. Predominantly then we're looking at people in the community, and they're in regular houses. They're owner occupants predominantly. 3/4 of them are in separate houses. Most have 3 or more bedrooms. And if you apply this CNOS thing here is shorthand for the Canadian National Occupancy Standard, which is used in Australia I should say misused in Australia, to measure under occupancy. It was actually originally developed in Canada to measure overcrowding, and it works quite well from that point of view. My argument from this research project we've just done is that it doesn't work too well when you look at under occupancy. We'll get to that in a moment. Around half have 2 or more spare bedrooms, and of course many more than that, 1 or more spare bedroom. In spare, you notice I've got in inverted commas, which we'll explain a little later. And if you take that as a measure of under occupancy, we did a 3 census analysis on that, and it increased 28% for Australia. So in other words, houses are getting bigger and households are getting smaller amongst the older population. So that puts paid to a lot of arguments about downsizing. 12% or more in 1999, this is from the Australian Housing Survey, had 1 or more temporary resident. A temporary resident is a person who stays over 20 nights or more a year. That pretty much requires you to have a room dedicated for their use. Now, our project was looking at older homeowners, aged 55 plus. You can see it was funded by AHURI, Australian Housing and Urban Research Institute. We did a national survey of 1,608 older homeowners around Australia via a national seniors magazine and an online survey, and we did 70 in-depth interviews in 5 states and territories. So that's what this data is based on. We found a higher percentage of people who had 1 or more temporary residents. And although our sample was pretty good representation of the older population, it did miss a few in the older age group and in public housing, obviously. So you can see the sorts of things that people, the sorts of temporary residents that are there, mostly relatives. 95% of our sample had 1 or more bedroom not used for sleeping, so ours are a little bit higher. And you can see what the spare bedroom use was. And one of the findings of our survey was that people do use the space, older people do use the space in their homes for things that are important to their health and well-being. 91% as a result regarded their home as either suitable or very suitable for their household. And they said they needed space post-retirement. Some said they needed more space. And I think some of us can probably relate to that. And here were the reasons: more time spent in the home, expanded home-based activities, need to get away from each other for couples. Interesting one that cropped up quite a bit. And also greater need for a temporary residence and family and friends to come and stay. And a very strong desire overall to age in place. We looked at the kinds of options that people had and said, in the event of developing a disability or increased need for assistance, what is important to you? And obviously the one that stood out much stronger is to use professional care services in their own home, less inclination towards retirement villages and aged care facilities and so forth, and very little inclination towards living with their children. We also looked at different approaches to inclusive design. I don't know what you know about universal design, visitable design, adaptable design, but they're three different modes of trying to design a house in a more accessible way. Universal being the best one because it doesn't require any modification later on. Adaptable requires modification but makes it a bit easier later on, and visitable means anyone can visit your home or you can visit anyone else's home that meets that minimum standard. And you can see there that people did favour, there's kind of considerable market acceptance or demand for, we think, for adaptable and universal design. We also looked at the activities that people are involved in outside the home, because it's one thing to have a home that's suitable, another thing to have a neighbourhood that actually is suitable. And for the reasons that were mentioned before about the importance of participation, you can see the sorts of things people are involved in. The dark one's the one to look at. That's the daily and weekly involvement in these activities, and you can see the sorts of activities there that are important to people: shopping, banking and retail, and sport and recreation being the two highest ones. We looked at barriers to neighbourhood participation, and I won't go through this in detail, but a lot of them had to do with footpaths, pedestrian paths. You can see some of the issues there. Transport infrastructure, public access buildings. There's still some older buildings that have very poor access for people. Public open space in terms of provision, design, lack of paving, shelter, public toilets, and then street fixtures and fittings lacking many of the same sorts of things. These are the sort of issues that people told us were barriers to their participation in the community. So what are the policy implications for this? Well, I guess there are two in terms of climate change adaptation. Well, I guess you can adapt in two ways. You can either stay in your house and make whatever modifications are necessary, or you can move to something more appropriate if it's available. And for those staying in place, modification, climate proofing are options. And there's certainly been some work done on the modification side, and recently, and although we know that that's not really adequate for the demand that's out there, and it does cost people quite a bit often to get the modifications done. Age-friendly neighbourhood design with the sort of things we mentioned before. More accessible public transport. Even though there is a program to make public transport more accessible, it's been rolled out over 30 years, which we think is far too long. It's far too conservative. In terms of moving to appropriate accommodation, improving the choice of housing type, location and affordability. Stamp duty exemptions for older movers, which takes away a financial barrier. Obviously improving energy efficiency of housing design. Universal and adaptable design, which the government has recently brought in a kind of access to premises standard for housing, which has never existed before. It's voluntary at the moment, probably should be mandatory. And may be mandatory in a few years if it doesn't work as a voluntary program. Greater innovation in the design of fixture and fittings. For a simple example, adjustable height toilets are a very important element. We don't really have them in Australia. They've had them in Japan for 20 years. We don't have them here. And a review of retirement village financial models, which are regarded by people as being onerous and not really encouraged